Thank you for being here, everyone, and welcome to what we hope will be the first of many events sponsored and organized by Community Health and Justice. So this is a new group which we are thinking of in terms of something kind of like in the interstices of a like a research center, a research hub, place where academicians and people who are working out in the field can get together, discuss ideas, a place that can be like a resource center, including a recording of this event, for example, that can lay out key issues and even provide overviews of successful programs having to do with community-based health initiatives. So what I really want to emphasize is that we encourage participation, as much participation as to the degree that people want to get involved. And in the future, if anyone wants to suggest a program, a kind of event, we'll be happy to work with you and actually eager to work with you on any such things. If you've got students, undergrads or even graduate students who are looking for information or looking to work on projects and so forth, we can try to connect them with people who are working in these fields. So as I said, we hope that the recording of this event will be available actually in multiple venues. Obviously, we'll link it to our website at communityhealthandjustice.org. And then we hope to distribute it and have, for example, a YouTube channel, maybe distribute it through Facebook, and just get the word out about not only this event and the issues that are discussed here, but also about community health and justice generally. So we hope to proceed in a pretty much an academic panel format with each person speaking for about 10 minutes, and then we can turn it over to general Q&A and discussion afterwards. You can either ask the questions directly, or if you want to put in questions in the chat box, in the chat window, I can refer to those as we wind up with the presentations. Any questions? Okay, so today we're hearing presentations by John Murphy from the University of Miami on the philosophy of community-based work. And we have Karen Callaghan from Berry University on history and practice of community-based interventions. Karie Peralta from the University of Toledo is speaking on what is a community. And Airin Martínez from the University of Massachusetts-Amherst is speaking on implementing a community-based intervention. And then we have Felicia Casanova from the University of Miami acting as our discussant. So without further ado, here's John Murphy.
Okay, I'm going to begin to share a screen here. All right, it actually worked. Okay, so what I want to do today is begin this discussion about talking about sort of a philosophical issue, which I think is central to doing community-based work. This may sound a little odd to some people because community-based work is oftentimes seen mostly as a pragmatic affair. So the fact that we're starting out with philosophy may seem odd, but from my experience, this is really a central concern that oftentimes is really overlooked. And as a result of this, many projects that aim to be community-based never reach that status. I mean, there was, in a sense, an original philosophy associated with community-based work, and basically the thrust of this philosophy was that people who were doing planning community interventions were supposed to be holistic. This was associated early on with ecological approach. And this ecological approach still today is seen as important. The problem here is that this approach, in my opinion, is insufficient at two levels. One is it's insufficient in theory, and the other, it's insufficient in that any philosophy that was operating, for the most part, was marginalized or was channeled in ways that made it sort of ineffective. So in a sense, I'm suggesting that this wasn't completely devoid of any philosophy. There was a guiding philosophy, but again, from my experience, this really was not as central as it should be. Basic to this philosophy are two principles. Okay, I mean, there's many principles associated with community-based work, but I've tried to narrow this down to two. The first is that local knowledge matters. Okay, in a sense, this move here is a move away from your typical sort of top-down approach. But this is more than simply seeking input. It's more than simply a consultation. It's more than simply trying to be sensitive. Okay, in a sense, what's happening here is there is a sort of a fundamental sort of a epistemological shift taking place here. Epistemology, in a sense, referring to the idea that there's knowledge at work here, and somebody's creating knowledge, and in this case, it's local persons. And to be community-based requires that you be attuned to this knowledge base. Basically, the idea is that people in communities are operating on a what you might call a local pool of information, and this information is what's used for people to make decisions. For example, about health. For example, identifying what it means to be ill. What's an indicator of illness? How do you respond to this? What are the possibilities available when people begin to think about themselves as ill? Okay. So in a sense, this is a radical move to get away from the idea that somehow there's knowledge simply out there waiting for people to discover if they're methodologically precise. There's something else going on here we have to be concerned with. The second idea is that there should be local control of projects. Here again, this is supposed to go beyond the idea of stakeholders, the idea of partnerships, and of course, again, is more than simply consultation. There's actually happening here what some writers have called a role reversal, where the people in the past that have been marginalized in these activities, because in the past, most projects were carried out by professionals who maybe periodically would consult with some local people, and oftentimes at the end of the project, maybe to get some buy-in. What this says now is that the local people now become the experts. Okay, so in a sense, these people serve as the guides to this knowledge pool. Okay, so in a sense, you may be thinking, well, why would you think this? I was involved in a study one time where we asked people, we asked planners what they thought were the problems in this community where I was working. Then we conducted some focus groups in this community, and what we discovered is that the identification of the problems were actually reversed. What the planners thought were the key problems were at the bottom of the list of the people that were in this community where I was working. And in fact, honestly, most of the official planners, their problems were honestly based on stereotypes. And so they were really sort of removed from what the community actually identified as problematic. The idea here is that this, in a sense, leads to this notion of participation. I mean, at the center of this community-based work, of course, is participation at different levels. But in a sense, participation here really has a philosophical basis to it. It's the idea here that people together create local realities. Okay, in a sense, persons are making various worlds in a community, and these worlds are comprised of various definitions, histories, cultural imperatives, and so forth, that people consider to be important for making decisions. Okay, so in a sense, persons act and live in terms of locally created interpretive knowledge bases. Okay, so in a sense, participation here is not simply involvement, but it goes way beyond that. In a sense, the participation that people or community-based workers are sort of courting here, if it's taken seriously, goes to the root of people identifying their reference groups, their sort of realities in terms of what is important and what isn't. This leads to a key idea, and that's the idea of world entry. The idea here is that communities consist of worlds, and to have an adequate project, to have a project that's truly community-based, people have to be trained to enter worlds. Now, this is very, very different from the idea that you should be, sometimes the language now should be person-centered, patient-centered, and so forth. What the people I've been working with lately, what we've been thinking about is what we should be calling for is the idea of becoming world-centered. You know, in a sense, becoming patient-centered or person-centered. Oftentimes, this is very narrow, and it can easily lead to attributing sort of basic, almost essential traits to these people or communities. World-centered comes from a different tradition, where the idea here is that people engage their realities and in this way lend meaning and significance to them. So in a sense, the idea here is that this pool of knowledge now, in a sense, can constitute various worlds, and to be community-based, people have to be attuned to these worlds and engage in world entry. What this leads to something I want to say at the end here, and this has to do with reading the world. Lately, I've been thinking about this idea of it seems that, you know, in many programs, and this is including training people who want to work in communities, we tend to be overly focused on methodology, and we train people to be methodologists. I guess what I'm arguing here is that we should be training people to be readers. People ought to recognize that these worlds that I'm suggesting people have to enter, these worlds, in a sense, the facts that are in those worlds, the data that are in those worlds are really biographical. And in a sense, this means that people who want to work in communities have to learn how to read the stories that people are telling about themselves, telling about their past, telling about the possibilities, telling about the future. It's those stories, those narratives that are crucial for successfully entering a world. So I guess in sum, what I'm trying to say here is that community-based workers, in a sense, should be focusing on, at the end of the day, in a sense of how to be able to read local realities. This is not necessarily synonymous with methodology, quantitative or qualitative, because both of those can be very problematic in this regard. Sometimes people who are working in communities automatically opt for qualitative methods, but I'm suggesting that those and the typically organized, qualitatively organized project, and oftentimes doesn't meet any of these standards in terms of what I'm arguing today, is that this philosophical shift that's necessary to be community-based. Okay, so that's where I'll stop for today. And I'll stop sharing here so someone else can get up here. All right, there we go.
Okay, well, as Vin said, I'm Karen Callaghan, and I'm a sociologist at Barry University, and have worked for a long number of years on various kinds of efforts and endeavors that we would call community-based. And I'm going to talk about some of those today, not what I've done personally, but I was given the task of talking about the whole history of community-based interventions in 10 minutes or less. So I did want to kind of emphasize a theme, because John has laid out philosophically what we have to think about in terms of what makes something, at least from our standpoint, a truly community-based effort, that local knowledge is taken seriously. And by seriously, we mean that it actually is the conceptual framework and the practical framework that drives the project. It's where the logic of the project comes from, as well as the real substance and purpose and direction of the project. And so that's, it's easy to agree with that, but in practice, there's much that has to be considered about how to make that happen. In addition to that, if local knowledge is going to drive the project, then we're going to avoid using a kind of extraction methodology where we go into communities to take their knowledge and to take whatever it is they have to offer us and use it ourselves to create projects or interventions. That's really not necessarily community-based either. And so we have to also find ways that communities are able to have significant input into and even control over projects over time. So we can find a lot of examples of how this has happened over time, but I thought what might be best for the kind of discussion we're having today is to talk about some of the intellectual and practical influences of what we call community-based work or research or interventions today. And then to give people a sense of the historical efforts to actually not simply from an academic standpoint to put these sorts of put this sort of framework into practice, what that has looked like. And some of you may be very familiar with this history, but some of you may find it interesting to know that community-based approaches are not just something that academics talk about nowadays through community-based research or through service learning or other kinds of things that are coming mostly from the academy, mostly from the university, but kind of taking a community-based approach has been a very important part of the way that any sort of medical and social interventions have been attempted in communities for really the past 50, 60, 70 years. And so I want to focus on those attempts a little bit so we can see what have been the problems. Maybe sometimes because, as John pointed out, the philosophical approach is not particularly community-based, but there are other kinds of problems as well that, and benefits that come from these kinds of approaches. So I think that's where we'll talk a little bit about. So some of the early influences for community-based work, some of you are very familiar with. We could even go back to the settlement house movement of the late 19th, early 20th centuries. And for sociologists, the one that is the premier example of this is what is known as Hull House, which was founded by Jane Addams and her colleagues, really as part of the University of Chicago. The University of Chicago was the first university in the United States to give graduate degrees in sociology. And some of the very earliest sociologists whose work with whom we're all familiar started out there. People like George Herbert Mead, John Dewey was not a sociologist, but in the education department, Albion Small, W.I. Thomas. I could go on in terms of the kind of people that really started the field that we know today as sociology. And Hull House was what is known as a settlement house. And it was basically, remember the time period we're talking about, we didn't have much in terms of social services or any type of institutionalized welfare agencies or support for people. And so these settlement houses were ways that primarily women often came together and actually lived in communities that they were serving. And Hull House is a prime example of what would be a community-based settlement house, and that it was not only located in the community, because as John said, simply locating your project in a community does not mean it's community-based. And you'll see over time when we look at some of these issues, how that sometimes has become in and of itself the definition for what a community-based project is. Okay, we've moved the location of the research or the service or the treatment to the actual community. Certainly better than having it happen in an institution, but certainly not meeting the standards that we're talking about as far as community-based is concerned. At Hull House, they delivered many kinds of direct services to communities. But one thing that was really interesting that they did that really has had a lot of influence on community-based research was they actually brought people from the community into the establishment, into Hull House, which eventually became not just one single home, but a whole block of homes, and had them talk not only with the people that lived in Hull House, but also with the researchers from the University of Chicago, and asked the members of the community, what problems would you like us to try to solve for you? So it became this very problem-solving oriented approach to delivering services. The attempts were being made not to understand living in the community and understand the problems from the standpoint of the people actually living there, and then to form action plans in conjunction with community members so that rather than looking at service as a type of clinical treatment or some sort of intervention provided by outsiders, it was the community members themselves that eventually were the ones that could find the solutions to those problems and actually carry out what needed to be done. If you've been studying sociology or you know about sociology, the name Clifford Shaw is probably very familiar to you, particularly in the area of studying juvenile delinquency and what became known as the CAP program, the Chicago Area Project. And the Chicago Area Project was really up and running until just a few years ago. In fact, it still may be in some form or another. But this was also considered a very innovative sort of project in that rather than delivering treatment to communities or rather than removing juveniles from the community to go into detention centers or treatment homes, it was decided that through using community organizing efforts and through allowing community members to have a say over what the problems were, that the community as a whole would come together, try to recognize the resources that they needed, and try to resolve some of their problems that way. Remember, at this point in time, sociology was considered incredibly innovative and cutting edge because we were moving away from looking at these individualistic clinical approaches to understanding problems that people were experiencing and looking at the conditions in which they were living. Like the fact that people might turn to crime because they didn't have jobs. People needed better education. Children needed to have schoolyards and things like that in order to be able to get off the street and not get engaged in delinquent behavior. One of the graduate students that worked with Clifford Shaw on the Chicago Area Project was Saul Alinsky, the great community organizer. And so another kind of example coming out of Chicago of a community-based effort was what eventually became known as the Back of the Yards Neighborhood Council. And Alinsky was well known for the fact that he had brought together a lot of disparate groups that people thought would never be able to overcome some of their conflicts and some of their competitive endeavors that they were engaging in. And that was labor unions, the Catholic Church, organized community groups. All these people came together and started to engage with people in the communities. The Back of the Yards was the yards they were talking about were the slaughterhouses. This neighborhood, that was the nickname of the neighborhood that was closest to the slaughterhouses in Chicago. Incredibly difficult area in which to live, very high poverty rates, very high crime rates. The residents were mainly immigrants and also migrants from different parts of the country. And so through several decades of the Back of the Yards Neighborhood Council, Alinsky was able to turn this into quite a thriving neighborhood. Again, it's not just an example of bringing services or resources into the community, but actually allowing community members to define their own problems and to work with outsiders, it's true, but to work with them as partners and collaborators rather than as kind of experts coming into the community and giving them their counsel and their advice on what to do. And then what came out of the Back of the Yards Neighborhood Council model was a very famous Alinsky organization, which still exists today, the Industrial Areas Foundation, not the most attractive name for a community-based organization, but Industrial Areas Foundations organizations exist all over the country and are responsible for a lot of major community organizing efforts that have gone on over the past 50, 60 years. Fred Ross, who was one of Alinsky's students and one of his, an Alinsky trained organizer, went to California and started doing organizing there. And of course, Fred Ross's most famous organizer was Cesar Chavez. And the United Farm Workers Union grew out of a lot of the activities of the industrial areas foundations that were founded in California. So you can look at these kinds of projects as major influences in what has been going on, particularly in the United States from this time, as community-based organizing and community-based interventions. Since we're all about health and justice, I'm going to focus then on talking about where we went from this kind of background, specifically looking at health projects and community-based health issues. And so we are now looking at, when you think about the history of how community-based work had become part of approaches that the US federal government was taking, we have to then look at what was going on in the 1950s and 60s, not only internally in the United States, but around the world as well. So in the post-World War II decades that we're talking about, around the world were these well-organized and very successful anti-colonialism movements that were happening in developing countries, and the traditional power of European countries was being challenged quite a bit. There were very strong democratization movements that were happening in Africa, in Latin America, and in places of Europe as well. And so looking at the way that communities could be developed with avoiding some of the political upheaval that was often accompanying these movements was something that the US government and something that the International Monetary Fund and other global institutions became interested in. And so it's interesting that part of the effort and part of the movement toward community-based work was in this effort to, yes, engage in the democratization movements that were going on, but to do it in a way that they thought was going to be not necessarily jeopardizing the political status quo too much. So you see in the 1950s, really the US studying what was going on in these developing countries. In the 1950s, it's also when you see the rise of something that has become a very important part of community-based work, particularly in terms of healthcare, and that is the use of community health workers in Latin America, the Promotores de Salud movement that started there. In the United States, the three pieces of legislation that I have on my slide, we could have multiple slides with different legislation that is tied up with this kind of work, but these were three laws that became extremely important in shaping how interventions were going to be done in terms of anti-poverty movements, in terms of mental health and medical services. Now, it's the influence of these laws is what started to help influence the way that academicians were looking at research and looking at interventions, but this is a little bit of a bumpy road that people started to down when they started to do this kind of thing. The Community Mental Health Act of 1963 often is used as the prime example of what we would call the deinstitutionalization movement in the United States. And that was, and again, it was described as an effort to move the treatment of even the most severely mentally ill persons back into the community. There's both philosophical issue, as John was saying here, that people wanted to embrace community-based efforts, but there's also a very utilitarian issue here, that people were learning quite dramatically that institutions were not able to effectively treat, whether it was mental health issues, whether it was health issues, or whether it was dealing with the side effects of living in impoverished areas with high unemployment. Institutions were not being particularly effective at doing this. So I wanted to give you a sense from looking at these laws that community-based efforts have been something that have been tried and true over the years and have been something that have been supported both then and now by some of these federal laws. When the Community Mental Health Act went into effect, it meant that something, if you worked in these areas now, you know the same, that you had to show that treatment was being provided in the least restrictive environment. That meant that the community had to have some say over how they could effectively engage in the treatment of people with these issues. There were community boards that had to be formed so that there could be some oversight over the treatment of people. The Economic Opportunity Act of 1964 is probably the most interesting in terms of community-based work, because here you see some of the language being used that says that anti-poverty programs, I'm paraphrasing a lot, anti-poverty programs have to be delivered, they have to be developed, conducted, and administered with maximum feasible participation of the residents. I mean, that's really saying a lot. And this was something that the implementation of these community action programs was something that truly became a sign of real revolutionary movement, both from the Republican Party, who saw it as a blueprint for revolution, as they said, as well as for the Democratic Party and activists in high poverty areas in the United States, who felt that this was a way that they would finally be able to control the resources that their communities needed in order to be successful. And then the Public Health Services Act of 1965, the original Public Health Services Act was passed in 1944 as part of the New Deal. But this particular version of it, particular Section 330, is what gave rise to community health centers. And community health centers to this day are a very important part of delivering health services to the poor. At present, there are over 1,300 different community health centers in the United States that serve close to 30 million people every year. They are now called federally qualified health centers, which means that they can charge Medicare and Medicaid. 90% of these 28 million people live at or near the poverty level. 60% of all community health center patients are Black or Hispanic. More than 50% are on Medicare or Medicaid. And in order to exist, a community health center must exist in a area that's designated in high medical need. In addition to medical services, they have to provide enabling services, which doesn't sound like a good thing, but enabling services in the federal law are those services that help people deal with whatever problems, immediate problems from which they might be suffering. So if they need childcare, if they need a job, if they need food assistance, those things are also provided by the community health center. And most importantly, from a community-based perspective, is that each community health center, each individual of the more than 1,300 have to have a governing board that at least 51% of the members are patients that actually are served by the health center. And again, the people that are writing in this area talk about this as the grassroots community-based nature of these community health centers. Certainly there's a lot of problems often that result from the community health centers being run as truly a community-based organization. And they are often related to the issues that John talked about. And those issues are also that are often cited as why the community action programs often were not successful. It wasn't just that people weren't aware of the philosophy that they needed to embrace, but there were also political backlashes to some of these, because people realized that whether it was poor people taking control of anti-poverty programs or poor people being in control via the board of their community health center, that this was a real redistribution of resources and a sharing of resources that were going to be controlled and decisions made by the local residents, by local people. So it's not just a philosophical issue that we have to grapple with. There's the political implications of that. And even as academics, if we're not always aware of those implications, others in the community are. And so I think that gives a whole different kind of sense of what our approach has to be if indeed we are going to talk about community-based work. So while at the same time it's very challenging in various ways, challenging to do, challenging to the existing power structure, we also have the evidence here that it is built into what the government has been trying to do, and there's ample evidence of this. We can not only just blame those that were politically challenged by, say, the poor people taking over the anti-poverty programs, but John mentioned the ecological models that were becoming more acceptable or more used in social work, for example. It was unfortunately social workers and other service providers that were often challenged by the fact that local residents were supposed to be driving the programs, especially in the 1950s and 60s, when this was a time when social workers, for example, were trying to create their own identity as professionals. And that's part of this philosophy that John is talking about, when outsiders come in as experts into the community, who not necessarily because of a political stand that they take, but because of their own disciplinary standards, feel that they know better than the community about how to resolve some of these problems. And then because I'm taking up too much time already, I wanted to share with you also from a global standpoint, from the World Health Organization, how, again, the Alma Ata Charter is on our website, because for many people, this was the global kind of turn to a community-based perspective, which again, you see some of the same language coming up in many of these different charters, that there has to be maximum community and individual self-reliance and participation in any planning of primary health care. A lot of connections with how community health centers were also establishing themselves. But this really kind of turned the way that primary health care and that delivering medical care in general was turned on its head, at least from the perspective of the professionals involved, in terms of how things had to make sense, things had to address the environments, the living conditions, the very life worlds of the people that they were serving. So in other words, any program, policies, practices have to be understood and make sense from the standpoint of the people they are serving, rather than from the standpoint of the people who are delivering the services. Thank you.
Got it. Okay. Well, first, I just want to thank the Community Health and Justice group for inviting me and for organizing this event. I also want to thank all of you who are out there listening and joining in with us in this conversation today. And I'm just going to start by addressing, my presentation today is to address the question, what is a community? And I want to start by just asking you to think about the word community. What comes to mind? And I'm guessing that when you hear the word community, what may come to mind, at least for some of us, may be a place or a neighborhood, place where people live, where they reside. For some, it may be a group of people with shared interests, like a group of writers or a community of runners. Or maybe you're thinking of an association of people who have the same profession, like a group of nurses or sociologists. Or maybe you may be thinking of a group of people with similar physical characteristics or cultural traits, like the Native American community. However, when we work from a community-based perspective, these traditional ways of thinking of a community are challenged. That's not to say, though, that we don't consider at all things like geography or interests or traits that may connect people together, but we do so in a radically different way. So what I'm going to try to accomplish in the next few minutes is just discuss about 3 main points to help guide us in understanding the concept of community. And the good thing is that Dr. Murphy and Dr. Callaghan have already laid out the groundwork and a good framework for understanding a community-based perspective. So it's really just a matter of applying some basic theoretical principles to understanding how we define community. So the first point is that a community is a field of different and sometimes even competing perceptions and meanings given to local realities, cultures, histories, and identities. In other words, it's an epistemological arena of and for community knowledge and local ways of thinking. Phenomenologists would say that we should regard communities as life worlds, which are collectives of intersubjective understandings of experiences, interpretations of local material conditions and interactions, and culturally grounded perceptions of dynamic realities. A community, therefore, shouldn't be viewed to be an object detached from human influence and designated by empirical reference. This shift in consideration is based on a significant change in thinking about language. Specifically, language is not neutral, but shapes reality, including the identity of any community. Due to language use, boundaries that are viewed typically to be exclusive and static can no longer be objective. So we shouldn't think of communities as if they were natural, objective things. Essentially, a community-based approach rejects the dualist belief in the separation of the body and the mind, as well as the positivist assumption that only information gathered neutrally is valid. So here, in saying that a community is simply a neighborhood, for example, between Main Street and Broadway, isn't necessarily consistent with a community-based perspective. Instead, we may be interested in, for example, how people who live within these boundaries may make sense of them and what their life and their experiences are like within them. And this leads to the second related point, which is that a community is based on participation. This element is central to community-based philosophy, and it's a theoretical game changer for defining a community. We have to recognize that community engagement is the site where local knowledge is co-created and verified through collective decision-making, which is also the source of conceptualizing a community. It's human action rather than physical properties that are important for defining a community. And due to anti-dualism, what should be emphasized are the demonstrated commitments in a community. So individuals decide if they're part of a community or not, and their actions confirm their membership. Although participation introduces interpretive dynamics that may make the parameters of a community difficult to locate in a traditional sense, this matter is not considered problematic from a non-dualistic standpoint. Because participation is valued rather than viewed to be a hindrance, the process of defining a community involves confirmation by its members. So for this reason, studies conducted from a community-based perspective often ask people to identify their communities. Portrayals of a community that don't go beyond the use of empirical indicators and involve a community's interpretation are therefore difficult to justify. Despite differences within communities, participation may lead to connections between members and in turn indicate a common ground for projects. This communal base, however, may expand and contract as members come and go, and while different people use their talents on various occasions. In this sense, a community is understood to be a realm that reflects various levels of commitment. Some community-based studies promote the view that a community is a unit of identity. Now, while this understanding of community incorporates various types of bonds, participation is often overlooked. In other words, an individual may have a particular association to a community, but it's active engagement that's necessary to fully realize this tie. In fact, all people must exhibit their affiliation through participation. No one should be presumed to be part of a community. Most community-based planners would agree that the importance of participation cannot be overstated. Ideally, this element pervades all aspects of a project, including how and by whom a community is defined. A basic idea is that all of the individuals who demonstrate actively their interest in a community can be considered members and then play a role in the group's creation. In this way, a community is negotiated through participation, and the possibilities of a community are specified by the ideas and skills of members. Now, some people may be wary of such inclusiveness and point to the likelihood for there to be greater tension and controversy. But in a community-based approach, conflict and disagreement are not situations to fear or avoid, because people can always navigate them through dialogue. And this leads me to the third and last point, which is that a community is socially constructed through dialogue. Dialogue that's guided by community-based philosophy involves entering a community's socially constructed world of interconnected perceptions, aspirations, and meanings given to everyday experiences. True dialogue is characterized as intersubjective engagement in which individuals recognize and accept their uniqueness as well as their responsibility to one another. And this process entails much more than, for example, active listening or clear communication as traditionally thought. It also requires reflection, reciprocity, mutuality, and the recognition of the other. The goal is to reflexively enter the life world of a community and interpret accurately its collective narrative and all of its unique experiential and biographical information. In other words, dialogue is more than simply applying techniques for effective interpersonal communication as commonly thought. It also requires grasping how this interpretive sphere is individually and also intersubjectively assembled. So taking an epistemological stance that recognizes that communities have intimate understandings of the realities is imperative to this activity. And this third point connects with the first and second in the sense that a community-based position promotes the appreciation of dialogical linguistic fusion of opinions, values, and expectations that individuals hold of their communities. So to conclude, I'm just going to reiterate the three main points for defining a community. The first is that a community is a vibrant realm of meanings that people give to their lives. The second is that participation is the foundation of a community. And third, that a community is socially constructed through dialogue. And just to end, the last thing I'll mention is that I would argue, as both Dr. Murphy and Dr. Callaghan have also argued, is that we really need to take seriously this process of defining a community, because this process has major implications for the ability of initiative to be relevant to a community and to meet local needs. That's it.
Okay, so my name is Airin Martínez. I'm an assistant professor at the University of Massachusetts-Amherst in the School of Public Health and Health Sciences. My training is as a medical sociologist, but I've been in public health now for maybe 8 years. And although medical sociologists are the OGs of the social determinants of health, going all the way to like Frederick Engels' The Condition on the Working Class in Manchester, much of my community engaged work is considered to apply for a sociology department. So that's why I'm in a school of public health. So today I will provide a basic definition of community-based health interventions, and then going through the levels of the socio-ecological model adopted by Brenner, I will discuss the levels of the social ecology, or through the levels of the social ecology, how community-based health interventions can be implemented and are accomplished. So I'm going to primarily draw from two community-based projects that I was a part of. One in Baltimore, working with Casa de Maryland, which is one of the largest immigrant advocacy organizations in the country. And there, the community that I worked with primarily was day laborers. So that didn't just include unauthorized Latinx immigrants, but it also included African Americans who were precarious laborers and also refugees. And then my other project, it was from a long time ago, but it was in San Francisco. And my community partner there was Mujeres Unidas y Activas, or United and Active Women, which is a labor collective of domestic workers in California. And the two reasons why I chose these projects is because the Casa de Maryland project, we actually did have an intervention, but there was a lot of disagreement between the community organizers and the actual day laborers about what should come about the project that we produced and the results that we produced. And then the other project, unbeknownst to me, like without even having the intention of creating a positive product or a policy, Mujeres Unidas y Activas, they found use in some of my data for them to use to help them promote the California Workers' Bill of Rights. So there are other projects that I'm working on now, and I'll show you in the next slide. But I think that these two may be better examples for the audience. Okay, so what are community-based health interventions? They're multi-component interventions combining individual and environmental change strategies to address multiple settings to prevent dysfunction and to promote health and well-being among population groups in a defined community. So as Dr. Peralta went through her presentation, there's lots of different ways that you can define community. And it's really just based, it's more important about how the group defines themselves, right? And who belongs in that group. But that's not to say that there isn't, that communities aren't heterogeneous and that there aren't disputes within the group about who should belong into the community or not, right? And so the community can be based, at least in my experience, it could be based on a setting, right? Like a geographic space, neighborhoods, or organizational, like churches. But the communities that I've also worked with have also been collectives organized around an embodied illness or a disease or experience, like being HIV positive or experiencing illness from unexplained exposures at the workplace. And then the communities that I've also worked with have been organized more recently around sociopolitical categories, right? Like living in a rural area, being low income, or belonging to a historically marginalized racial, ethnic, and migrant group. And so here's a picture of my current community partner and my colleague, Ana Jaramillo. She's the community convener for obesity prevention initiative in Holyoke, Massachusetts called Let's Move Holyoke 5210, or in Spanish, A Moverse Holyoke 5210. And so basically in this project, I mean, I'm like, they've already had this coalition since 2012. So they allowed me to come to the table. It wasn't like me saying, okay, let's do this project. No, I learned about the group and I found out that they were a multi-sectoral group trying to address obesity and food insecurity in Holyoke. And then, you know, after like a year of meeting with them, they said, okay, we'd like to work with you. And then they asked me to be like their scientific evaluator of their project. So I'm not going to talk about this project because partly you can ask me more questions about it in the discussion, but we're in the middle of an evaluation right now. And because of COVID, it was stalled for about 5 months. But we've had very interesting experiences, not so much changing things in the community as we have been changing more the relationship between the university and this community, and creating more equitable practices between the ways that University of Massachusetts administers community grants and funds them. Okay, so in terms of community-based health interventions, many of them try to attempt to, most of them actually try to attempt to change people's behaviors. So typically you see this work is revolved around risky behaviors, like people using tobacco or engaging in unhealthy drinking and eating or being physically inactive. Or in some cases, like in my own department, people try to examine why is it that people aren't taking advantage of the ACA healthcare marketplaces and trying to encourage people to enroll in health insurance. The second aspect that community-based health interventions try to address is really what Dr. Callaghan was really talking about, right? Issues of distributive justice and redistributing resources. In some interventions that I've seen, and even with Let's Move Holyoke, a lot of their work historically has been revolved around referring people to different services in the community that can help them with achieving food security in their households, or giving people access to a food bank, or enrolling them in food subsidies programs or nutritional programs like SNAP and WIC. But also helping people pay their utility bills so they can have access to more food, or even access to technology. Some things that we often take advantage of, sharing or healthy, right? Having the means to actually be healthy. Another way that community-based health interventions can try to improve health within communities is that, you know, I think this is more recently, I think with the growth of community-based participatory research in public health has been this emphasis on increasing rights, recognition, and resources, or procedural justice. And this is where it becomes really important to think about what are the politics that happen in communities. So one of the things that we've noticed, like at least through this project that I've done in Holyoke, is that there's, you know, although much of the intervention is geared towards youth, because even in public health, we think, oh, this is where we need to work because we can make a difference now and prevent chronic disease later with young people. But the problem is that young people aren't even at the table. There's a 15 organizations represented in this coalition, but one of the things that we have found is that we don't have youth sitting at the table, right? And so how do we get community members who are often the implicated actors, or the people who are often, they're the subjects but not the agents of the project, be a part of the process, right? And be civically engaged in the project. And how do we maintain fairness in decision-making processes that take place within marginalized communities? And how do we get them to practice not just governance in the project, but then at a larger stage, right? So the whole goal of doing something like a participatory or community engaged health intervention is really that we're moving people to action. We're not just producing evidence and research for knowledge's sake or to verify people's reality. Yeah, things are messed up and there's pollution in your neighborhood and compared to another one. No, it's really to move people to action, right? Whether that's the action of local policymakers or elected officials, or moving the actual community members to do something about their situation, right? To motivate them into action. And then lastly, the more difficult community-based health intervention, and one that if you're in a community long enough, I mean, this is really the goal, is that you're changing structures of oppression through structural interventions. So in this form of structural interventions, the goal is that you use the evidence from your projects to really produce laws, policies, or changes in the built environment that lead to health equity, right? Or ensuring the conditions where all people have the opportunity to achieve health and well-being. The most commonly implemented community-based interventions are those at the individual and interpersonal levels, though, to change risky behaviors. And there's more and more emphasis now on structural interventions, but it's not necessarily funded by the federal government. You're not seeing the CDC or the NIH fund as much structural interventions. Most of this work is now funded really by the foundations like the W.K. Kellogg Foundation and the Robert Wood Johnson Foundation. And so although a lot of the interventions that we have in community-based research are focusing on the individual and interpersonal level, we know, not just theoretically, but we know in practice that if we're going to change anything, we have to change things at the larger levels of the social ecology. So policy and the ways that communities are organized, and of course the organizations that even provide those services to those communities. How can they be more equitable in their approach, and how can they actually address social, economic, and political conditions that produce the environments that lead to risky behaviors or adverse health outcomes. Let's see. So something else here that I wanted to mention. No, I think I'll mention it in the next slide. Okay. So some of the approaches to community-based health interventions, so people either use non-participatory methods or participatory methods. So when we think about non-participatory methods, it's like the usual top-down that we've been critiquing throughout this presentation, right? Where the experts identify the needs and the goals of the community, versus doing a participatory project, which is more grassroots, where the efforts by which communities sharing a common interest are identifying what their specific needs and goals are, right? They know what types of resources they need to mobilize within their communities. And us as academics, we're basically there, like for me, at least when I've done this work, the community tells me what to do. I ask them, what evidence do you need? And then I figure out a project to help them collect the evidence that they need to take action, right? And achieve the goals that they need collectively. And so part of my training is in community-based participatory research through the W.K. Kellogg Foundation. And I know it's like, that's its own indoctrination and institutionalization of an approach, right? Where we can use whatever method we want, but the whole point is that we're producing equitable research collaboration with the communities that are affected. And we use their broad experiences in order to inform the problem, but also really not just inform the problem, but design the research project from start to finish, from the design all the way into the dissemination of results. But ultimately, really, participatory approaches are supposed to really create these positive products, right? Whether they're a community-based intervention that's defined by the community and run by the community, or policies. And so some of the ways that people measure success. So this is one of the biggest critiques about community-based health interventions, is that we often don't come to the point where we evaluate the actual intervention, right? So then it's really hard to make the case, oh yeah, how can we support participatory methods if we haven't really evaluated the effectiveness of these interventions? So some measures of success, and part of it is, I think, that the measures of success for academics and policymakers are often disjointed for the ones from community members. And so the first one is that, so the metrics that we use to convince policymakers or our funders, yeah, this was a successful intervention, is that we often want to show like a reduced incidence of a disease or risky behavior, or we show increases in positive outcomes, right? Like an increase in more time spent doing physical activity, less time eating junk food, more time, drinking water and not sugary beverages. But we know that the reduction in cases doesn't always mean, or doesn't always imply, that their success, if health inequities exist still in that community, right? There may be so I'm even thinking about the coronavirus vaccine when it finally gets rolled out. You may have an increased number of people who are vaccinated, but if there continues to still be disparities in communities of color who don't have access to the vaccine, then those numbers don't mean anything if they're not contextualized. The other piece is that where we feel that where we try to measure success in community-based interventions is through prevention strategies. Do we create a strategy in which people can prevent altogether from actually having this negative health outcome, right? So one example in the work that I do is often with obesity or healthy food access, right? How do we prevent people even coming to the point when they have SNAP that last week in the month, they're relying on junk food to meet the nutritional needs of their family, actually creating a preventative strategy before they even get to that point. The third one, and I think the one that many of my community partners feel is the most important, is really the fact, and this is one that doesn't even get recognized as much by policymakers or funders, is the fact that we've actually engaged more community, right? More community members who were never really civically engaged are becoming involved. So even if we can't reduce the specific health metric, like something like a body mass index, just having community involved in the research process and engaging in that civic engagement and building capacity in the community could be considered a win for many people. Okay, so one of the projects that I was a part of was working with Casa de Maryland during my postdoc. And so in this particular project, I led a community-based participatory health needs assessment, or an occupational health needs assessment, of Latina and Latino day laborers and other day laborers that were seeking work at the Casas. They had a hiring hall in Baltimore. And so this is where precarious workers and immigrants would come for work. And then the only stipulation for employers to hire people in this hiring hall was that they were paying them a living wage of $15 an hour. And that was like in 2010, between 2010 and 2012. So now it would be much more than that, I would hope. So we also interviewed leaders to assess how receptive several government agencies were in promoting occupational safety for the growing immigrant population in Baltimore. And so what was really interesting in this project was that the workers, they really wanted not just a behavioral type of support, right? They wanted better tips from Casa de Maryland about, okay, what can I do to negotiate better working conditions from the employer? And they also wanted, the other recommendation that the workers had was that they also wanted Casa de Maryland, like if an employer came to seek employment from one of the workers in the hiring hall, that they would sign a paper or at least agree to provide safe working conditions. So not just providing safe work conditions and providing personal protective equipment, but also allowing the actual workers to seek healthcare if they were injured on the job. And so what's interesting is that Casa de Maryland, actually the work development and vocational training leadership were not in agreement with this second part that the workers wanted. And they said, well, if we do that, our whole operation will end. We're never going to have like employers come here. But the workers, they were still kind of disappointed because they're like, I think that if they sign something or if the employers agree to provide us with safety, then maybe we'll have a better shot at not having a dangerous job, because people were coming in saying, oh, we need you to clean up the house. But then the workers would say, we just cleaned up a bunch of sheets with blood. And so, there was a lot of precarious situations and dangerous situations that they were in their jobs. In the end, we ended up agreeing to coming up with a behavioral and partly a behavioral intervention by creating these safety backpacks that were both gender and occupation specific for workers in cleaning, construction, and manual labor. And then the safety backpacks ended up having also information where people can report unsafe work conditions or a contact number at Casa de Maryland if they were being mistreated at the work site. But we didn't actually create the organizational change that the workers wanted from the intervention. Okay, and then the last project that I'll talk about, and it wasn't necessarily a community-based, it wasn't initially supposed to be a community-based health intervention. This project was actually part of my dissertation where I examined Comiendo Bien, or the lay health practice of healthy eating among Latinx immigrant families in San Francisco. And what ended up happening in that project, like I was doing that project mostly to describe what the practice is and to identify what transnational, not acculturation processes sustain and transform the practice. But one of my community partners was a Latina labor collective, Mujeres Unidas Activas. And so one of the findings that we actually had in the study was that, you know, so many of the women or many of the parents were low-wage workers either in Latin America or when they were in the context of the US, they were unauthorized racial minorities, often working in the informal economy as, you know, caregivers, personal home aides, health aides, and healthcare providers. And so, or cleaners. So then because of that, we, you know, one of the repeating like themes that I found like in this project was really that the people had this, even though they knew how to practice Comiendo Bien, they couldn't really implement it because even if they were working 2 different jobs or working multiple homes in one day, they never had a break. They never had a chance to take a break, have a meal, and, you know, and be able to practice Comiendo Bien. And it didn't just disrupt their own individual ability to practice Comiendo Bien, but it also didn't allow them to reproduce the health practice at home. So strangely, I never thought that this one finding would be of importance, but the women at Mujeres Unidas y Activas, they used some of the evidence for them to push forward like I mean, it was many years. It took maybe like 10 years for them to actually advocate for the California Domestic Workers Bill of Rights. And so for them, they felt like, oh, but we can use this evidence somehow. So it's just a lesson as to how you may not even plan. If you're working with community partners and you're involving them in the research process, even if your project initially isn't designed to look for a specific outcome or to make a specific difference, that's why it's so important to share it with your community partners and with the people involved, because they may find more use out of your data than you do yourself, right? Because our work just ends up in some journal or some published book, but it may not be of use to them, right? It's more of use to them if they can use this information to change a condition that they have, that they're in. Okay, okay. So in terms of getting it done, I always think that although I don't follow like the socioecological model to the T, I do think about my projects through those levels, because I think as health researchers and practitioners, we're often producing the evidence and documenting the histories and testimonies of historically marginalized persons in community-based health interventions. But we also need to ensure that we communicate our findings to community partners and locally appointed and elected officials. So this is important because not only do you verify the community's reality, but you're moving people to action, and not just the community members themselves, but the actual people who can change or influence the situation that they're in. So I never thought that sharing these results would actually be a part of their evidence and documentation to support their years-long effort to pass the California Domestic Workers Bill of Rights in 2013 under Governor Brown. But it wasn't until 2019 that they expanded this Bill of Rights to include outreach and education component to inform the public. So not just employees, right? So everything is always placed on the individual. In the 2019 expansion of the bill, they were also informing the employers, right? About how, you know, what are ideal work conditions for domestic workers. And strangely or interestingly, Senator Kamala Harris and Pramila Jayapal, they drafted similar bills after the California Domestic Workers Bill of Rights domestic worker rights in 2019, but it hasn't gone anywhere. It's still under review. So when I think about my projects through the different levels of the socio-ecological model, I always think about identifying local and state and national policies that perpetuate the systems of oppression that are creating the conditions that the communities are in. And oftentimes your community partners know what they are, they can identify them. But sometimes, I mean, it's the most difficult level to change, the structural level or the policy level. And that's why we need to be, if you really are dedicated to it, you have to stay in the work for a long time. And I think that it's one of the hardest parts of being an academic is that, you know, if you move around institutions, it's hard to maintain that sustainability or for you to be a part of that process. The other piece is that, you know, even though, you know, there's criticism to be made about community-based health interventions that are addressing the interpersonal and individual levels, but at the same time, they're a way of putting out fires. So when I was doing the Comiendo Bien study, and also when I was the project with Casa de Maryland, you know, there were individual level interventions that were being implemented as a part of that process. So with the mujeres, they're like, you know, we have a lot of childcare providers and people providing home assistance to older adults. Is there a way that we could have charlas about poisoning or safety or different things or stages of development? And so even if I couldn't provide all of that expertise, because I'm not an expert on everything, I would ask my colleagues that were experts in these areas to provide those trainings. So of course, even individual level community-based health interventions are really important because like one of my colleagues, Brenda Evans, says, it really takes people out of survivor mode. And it really helps them address immediate needs so that they can be a part of that longer sustainable project to, you know, to get to that structural level change. But then also there's the need to do community level and organizational changes at the meso level, finding where micro and macro meet in order to change maybe policies at the local level and to create coalitions with other community stakeholders or other communities that are also experiencing the same problem. So with the Mujeres Unidas y Activas, they were really great about partnering with like the American, Asian, and Pacific Islander Health Forum in the Bay Area and making sure that they were also tapping into Southeast Asian migrant workers that were women in domestic positions. And so we have to like also work with other organizations and other groups that may not identify with that same community at whatever lines you use to draw that, but that it presents an opportunity to build a coalition with other groups. And so the reason why I say this, okay, so I saw this meme today on social media. I would have written it differently, but it was on Twitter, so I give them a pass. But basically, yeah, you could give a person a fish and then teach him how to fish. But this is why I think even so, as much as I want to have every single community-based health intervention address the structural level, we have to still address the individual and interpersonal because, I mean, it's a lot easier for them to learn how to fish if they're not starving, right? If they have their immediate needs met. And also, yeah, that when you're doing your research and your interventions, and even if you're not aiming to inform policy, that you really share your findings with community members, other coalitions who are working on similar topics, and locally appointed officials or elected officials. Yeah, so that's it for now. Thank you. I just have one small plug, not my book, but really, so I'm the scientific co-chair for the Latino Caucus for Public Health. It's the oldest public health advocacy organization for Latinx communities in the US. Our membership is free this year because of COVID. There's the link. And it's really cheap. Actually, on a regular year, it's $40 to $20, depending on your income level. But we have really cool programming throughout the year. We have a podcast called Sana Sana. If you know the Finnish of that, Sana Sana, Colita de Rana, whatever you say in your language. But we have a really cool podcast and we have really good scientific programming throughout the year. And if you're interested in these topics and other people doing community-based health interventions, we're there and we're at national conferences too. So thank you.
Great, thank you. And then to wrap things up and in the form of a summary, we have Felicia Casanova as our discussant for tonight.
Hi, everyone. So everyone, I thank you all for your comments. I thank all the participants as well for being here. This is so interesting and, you know, getting the contribution of all these folks that have not only contributed in their scholarship, but also the work that they've done in their communities as well. We had the philosophy from Dr. Murphy, and getting us to think differently about how we see communities and what we need to do before we even start a project with the community, and engaging even throughout the project, having those things present. With Dr. Callaghan, giving us the rich socio-historical perspective of community-based research, community-based work in the United States, in the context of the United States. That was great. That's some of the stuff that I particularly sort of work in my research on community health workers. So that was wonderful to hear. And some of the stuff that I didn't even know, some of the work in Chicago. That was really interesting. And Dr. Peralta as well, with her conceptualization of what a community is, and the components that go into making a community, and pushing us, challenging us not to just reduce community to, a space or the people that you have around you, but, pushing further and thinking about what it really means. And finally, Dr. Martínez, who really talked about her work and the practice of community-based work, the challenges as well as the successes, which is important to hear. I do community-based work, and a lot of the things that she said resonates with me as well as other people that are here that work in the community, like Eunice Hines, who's here. She's the director of migrant health at CHI, Community Health of South Florida, and she works with the farm worker community. So, and she also leads all the community health workers in the community, and so they do great work. She does great work, and so I wrote some notes. I took some notes, and I have some questions. The first one is, how can we improve local control in our institutions? Because a lot of folks, whether that's at the university level or even at a HQFC, like where Eunice works, how can we improve when we're tied to sort of these funders or institutions? How do we improve the local control? Oh, and I see Rosario also has a question, so I'll answer. I'll allow you to ask your questions once someone answers this.
Giving them access to the money. So, I mean, at least in my projects, I try to write the community partner as a subcontractor so that they can control their funds. And from the beginning, when you're writing the budget, that you're being honest about, that you're encouraging them to add as much as they can, like on that budget. And so I think that's been the biggest struggle, at least for me, but I know that it's one of the most important in order for them to have autonomy and governance on how they run the project. And for this project in Holyoke, I think I'm really happy that I fought like tooth and nail for the community partner to have control of their money, because as a result of COVID, we had to change the project. And we had to change the way that the participants were being compensated for their time. So, so one of the incentives that we had was people having a 5-day pass to the YMCA, but now the YMCA is closed because of COVID. So then because they had control of the money and not me, they were able to change the incentive structure. And I know that's something simple, but I think something like just allowing them to control the money is really important.
Yeah, thank you. And I know Dr. Murphy is actually working on a project like that, so I'm sure he has a lot to say about that. Oh,
you're muted, John. You're muted.
Yes, we just started a project now on participatory budgeting, and what I can tell you is that universities, for instance, have a long way to go in this area, because even though this was a participatory project, a community-based participatory project, the university knew exactly what they were funding and so forth. But when all of a sudden we wanted to pay people in the community for their time, because most projects don't do that because they figure people's time in the communities are just useless, so they shouldn't be compensated. we got 3 months and we still don't have any money. You know, so in a sense, and we're getting to the point where we need to start paying people. And the same thing was happening in California. Like UCLA, Jung and I were involved in something there. These people wanted to get out in the community, but they didn't even know where it even was. You know, but they're always talking about, you know, we want to get it. You look out the window and there's a community there and so forth. So these universities are sad sacks, man, and they really got to figure out, you know, what they want to do. And if they really want to be community-based, some serious changes have to go on, even at the highest levels. And I've been pushing on this budget thing up to the level, the provost. I want to get the provost in the office where I'm at. And we're going to talk about this, you know, because I just want to go the whole 9 yards. I figure if I don't do that, then I'm just not going to feel satisfied, you know, and so forth. So I guess if you want to get money to the community and you're working through a university with money, you got problems, you know, because these guys just don't get the picture, you know. And I've been beating my head against the wall now for years on this, and it never seems to end, you know.
So a good thing though is like, so the Robert Wood Johnson monies, they want the community partner to have, like in some of their funding mechanisms, they want the community partner to administer the grant to bypass this issue with the university. Plus the university wants all the overhead is another big issue. Yeah.
I just wanted to jump in and add that I think from the start, you have to have an open mind about timelines. I mean, a lot of this funding comes with timeline stipulations. And right away, if you're trying to promote a community-based project and the community is feeling like they're being rushed or that, you know, it's not on the community's time, that right there is, you know, a contradiction in what community-based philosophy is trying to promote in the first place. And you're going to lose interest, motivation. People are going to feel like it's not their project. So considering time constraints is a big issue.
I wanted to allow Rosario to ask her question. I know you had a question, Rosario. Rosario is one of our colleagues too.
Hi, good afternoon, everyone. Thank you for the insightful presentation.
Sorry about that.
Can you hear me?
Yes.
So my question is, it's related to how the community-based approach envisions social change, because I think that the taken for granted assumption is that we're in some kind of sane country or democratic, like think makes sense. And so there is a group in American society saying, no, this is not sane. So we need to abolish institutions. So that makes me question about, it's the final objective or the most important objective to create structural change via policy? It's just that for example, from a law enforcement and criminal justice perspective, changing policy, it's not going to change anything. So how do you envision facing this new reality where we know what a policy is, what an institution is, and yeah, that the possibility of generating structural change from that perspective is in question now? That would be my...
Somebody want to start?
I would start local. It's not that policy changes can't happen. You have to start locally. I mean, right now, I mean, you have to take advantage also of the moment. So, I mean, when I started my postdoc, when I was working with CASA, I mean, it was the Obama years, and not that that was glorious, but at least people listened, you know, and, you know, we had to do Hill visits, and we went to the Hill and we would meet with different senators and House of Representatives, and they at least listen to the evidence. And you're right, like nowadays going on a Hill visit, you know, in DC is not, you're not going to have that same receptivity from policymakers, right? Or like the people in Congress. But I think you have to, right now, I focus on a lot of local level policy, right? Because I live in Massachusetts now, and it's here, the state legislature is very receptive to evidence, right? So you have to, and policy doesn't have to be like at this, you know, at the jurisdictional level. It could also be organizational, right? So what the workers were pushing, they the worker center, they just wanted CASA to make sure, okay, not just that we have this basic minimum of having a living wage, but why don't we actually also have the employers agree to just provide us a safe working condition if we get injured, that we are able to seek health care, right? And that it won't jeopardize our job. So even an organizational policy is something that's really important. So yeah, and the criminal justice system, I'm less informed with that. So I'm just going to leave it with someone else, but I don't think that it's impossible, because if we start from a place that the policies can't change, then I don't know if it will change, right?
Thank you.
Yeah, I think Airin is correct. I mean, this all has to start from the bottom now, and there was the book that was written of the people's history. And I remember we were talking to this guy, and he says, nothing's ever started from the top. Everything that made any sense at all has started from the bottom. Okay. Now, are these people at the top ever going to listen nowadays anymore? Or do they have to just be swept away? And maybe that has to happen. I mean, it's hard. It's really hard to say. But if you're depressed about what's going on, I mean, for me, you always have to have faith in the people. Sometimes they let you down, and sometimes they don't do what you think is going to happen. But where else are you going to go? And you can have a bunch of elites there. They don't care about you. So this is so I just have faith in the people. But you have to work and work and work, like she says. It goes on.
I think anytime, and I, Rosario, I totally relate to your feeling. And what I often kind of think about is that the people in control think policy does a lot. So we know that policy really does matter sometimes. And one of the things that in the past that people often were able to do to get some movement forward, whether it's going to be actual structural change will be another thing, but was to, as John said, was to really look at this as a bottom-up approach. And that means even those communities that many of us may not agree with ideologically are going to have their say as well, but in a way that is local and that's productive for them. And they may not, a lot of people are embracing, I think, what a lot of us see as this very destructive kind of perspective or ideology, because they feel completely overwhelmed by institutions. And they feel that this is the only way that they can have any kind of self-efficacy, or they can have any kind of access to not simply being overwhelmed by what they see as this outside world. And so even in terms of the issue with the police, I mean, we can trace easily the policies and the practices that have been put in place over the past 25, 30 years that have created what we now call the police, which is completely militarized. I mean, when you see, like I heard another commentator see this, when you saw the protest over the summer, you see the people in general just out there in the streets looking like ordinary people. And then even in the pandemic, even when the economy is crashing, you see the police coming out there looking like they're from a Star Wars movie or something. The amount of funding that has gone into the police. And again, it's a matter of, where you think control lies and where you think you can go with this community-based perspective. It's really interesting. If any of you go back and are interested in this thing, read about, the analysis of those community action programs, where they were saying there has to be maximum feasible participation. And what really shocked people, both on the left and the right, was that poor people actually wanted to participate. Many of the people who the so-called left, who are more like the center, thought that this was not going to be that dangerous because they were buying into the same stereotypes. Poor people are lazy and they're not well educated. And yeah, they're not going to take the time to go to a meeting, and they're not going to understand all these processes, totally ignorant of what had been going on in the civil rights movement, particularly with the more of the Black nationalist movements in urban areas, where people were already becoming autonomous and already creating their own social services and everything else. So it's very easy to feel daunted and overwhelmed by what's going on. But at the same time, we know that, these processes can work. And the only way we're going to be assured of an outcome that I think is not simply from a standpoint of domination from the top down is to begin to work in communities, and maybe a little bit in answer to the previous question, to find every way that we can to kind of allow the sentiment and the voice of the community to be put in places where it normally doesn't go, and to just make sure it gets in there, rather than as researchers or as service providers or consultants, rather than making sure that we get some outcome that's important to us, to just get those voices out into places where they need to be, and to find the best allies that we can for that.
And can I just jump in just real quickly? And I agree with everything that other people have said, and in particular with what Karen was talking about. It used to be, a long time ago, I used to think like, we gotta just either overthrow everything or nothing. And then I'm thinking like, gosh, well, that still stands. We still gotta overthrow everything, okay? So that didn't go away. But I think we really have to understand that we really have to put everything on the table. Everything is an option, including policies, right? Dr. Murphy sent me a little thing with Paul Gilroy a couple of days ago, that there was a little interview in The Guardian, was it, right? And there's one part where he says, no matter what, he says this, and that, but there's one part where he says, we don't have the luxury of being pessimistic, right? And that kind of struck a chord with me, right? Because the idea is, pessimism doesn't get us anywhere. Pessimism is the idea that we do not act. We're almost resigned. So we could be pissed, we could be sorrow, we could be sad, but we can't be pessimistic, right? Because we gotta act. And some of the things that while Dr. Peralta and Dr. Callaghan, when you guys were talking about some of these issues with history and some of the real, what is that community, I was just kept on thinking, just even a simple or small just aspect of community engagement could change a lot of different things. Imagine if we were to actually support that with the kind of philosophy that you folks are talking about, right? So like in Oakland, I've been following this for several years now. There's this, thing called Streetwise, and it's actually done through a mobile app and so on. But, they just realized in certain neighborhoods, they were actually classifying convenience stores as grocery stores, right? Just because they sold more than 10 pieces of fruit, right? Which is the cutoff line for a convenience store. You gotta have 10 or less, right? So if you had like 12 apples, it's all of a sudden not a liquor store, but a grocery store. But the important part of this was that certain neighborhoods, there was so much funding that were available that was not being distributed to a lot of these local neighborhoods, because these local neighborhoods were not actually officially designated as food deserts, when in fact they were, right? So then when the local people got involved and say, what are you talking about? We have fresh food. There's no grocery store. There's a liquor store here, liquor store there, 7-Eleven there. And they're like, what are you talking about? On paper, it says they're grocery stores. When the local people are saying, that's bullshit, right? That's not grocery store, right? Yeah, you take an apple with Jack Daniels, come on now, right? So just a simple, engagement by the local people. And it didn't even involve a lot of the kind of philosophical thing that Dr. Murphy's mentioning, right? So even at that level, right, I think everything really does have to start from bottom up. And I just kind of get it, as much as we kind of feel defeated many times, I'm still very much optimistic in a sense that, man, little change like that, right, slaps these guys around. So imagine when Dr. Murphy actually has a day with the provost, right? We'll see what happens, right? But we can't be pessimistic. That's one thing I know, right? What were we going to do with our lives anyway? Right? Other than to fight on behalf of justice. What were we gonna do with our lives anyway? What's so important, right? That's all I gotta say. And I appreciated everyone's presentations. I enjoyed it fully.
Does anyone else have a question? Because I have one I can throw out as well. Well, here goes. So how does this pandemic of COVID present opportunities and limitations for community-based work?
Well, you're the one that probably should answer that because of how this has affected your dissertation.
I'm working on it.
Yeah.
You know, again, reimagining community, right? And what that means for people locally. And how people are able to still mobilize and do things despite creating other pathways to mobilize and to create action. Yeah.
Yeah, well, this is also, I mean, I'm just, well, she doesn't want to talk about this, so I'll say, this is also brought up in her dissertation, the idea of how to use data in terms of how to collect it, and when you can't get into these communities the way you would like, even possibly the use of secondary data, where for most community-based people, this would be, you'd try to avoid that at all costs, you know? So in a sense, this has opened up, at least and theoretically, about a lot of things that need to be addressed or weren't being addressed before, you know? So anyway, that's, well, she's experiencing this right now. Felicia's experiencing this right now. You know?
I wanted to add that, and I don't know how this is going to come out because I just started thinking about this today after I saw a post on social media from my cousin who's a respiratory therapist. And it was something along the lines of, we're no longer the frontline workers. You all are the frontline workers when in relation to mask use. And so just thinking about how, again, going back to how do we define a community, and also when interventions are able to work or not, or meet the needs, is, you know, we have nurses and doctors saying, you're part of this medical community, just, you know, everyday people, you're part of this community. And for this to work, like, you need to start thinking of yourself as part of this community, and also, you know, make the commitment to these kinds of interventions that we're saying are important. So I don't know, just something I was thinking about today.
I mean, so Felicia or Dr. Casanova, like I'm having,
yeah,
no, but it doesn't matter. I don't want to be elitist, but so anyway, so I mean, at least in our project too, like in Holyoke, it took like 5 months though of meeting with the 15 people, like in the coalition with the 15 different organizations. And, you know, we were administering surveys face-to-face because there's a lot of literacy issues in Holyoke. And so we were like, okay, we have to finish this project, but we know that there's a lot of challenges doing this in person. And, you know, especially because we were doing recruitment and data collection in FQHCs, in hospitals, at WIC, SNAP, Head Start, and these are places where we're not allowed anymore, right? So we had to come up with a strategy. How can we do some of the, you know, for people who aren't affected by the digital divide and have access to, you know, internet and are comfortable using technology, can we give them the survey this way? We know that we're going to have like, you know, selection bias issues with that, but we just have to acknowledge it. But then then the service providers, so that's why it was important that they had control of the money too. So then some of the service providers, they had to use part of their grant to buy out some of their time so that they could administer the survey. And that wasn't initially the plan. The plan would be myself and my research assistants, like the undergraduate research assistants, but that's not the case. And then my RAs went back to Puerto Rico because they said, our insurance doesn't work in Massachusetts. So guess what? We can't do this project. So, you know, it worked out in the sense that, you know, our different community organizations decided to do the data collection. So the FQHC can't do it anymore, but we just shifted the project, but they were the ones that came up with the ideas, right? I just helped them move the survey to different platforms, but some of the interviews I had to also, so I'm also in that project, we're also doing interviews with organizations like who want to be a part of the coalition, but what have been challenges about joining the 5210 movement. And so we just did that on Zoom, right? And so, I mean, you just have to be really flexible. But I think one of the biggest challenges though about that project was the fact that we knew that if we just did it completely online, that there were going to be people who don't have internet or like a large data plan, that they would be left out. So then it was up to the community partners or like the actual service providers to decide whether and how much time, like even if it's 5 hours a week, like how much time could they actually do this on their own? Because they were going to see clients anyways. Yeah, but we had to pay them for that because they're not, you know, they're not getting paid to do research, right? So yeah, you just have to figure out ways, and money helps, but it's not everything, but money does help.
It does help, and
it does help.
I've been working with the Florida Community Health Worker Coalition here to sort of reimagine how my data collection can go in terms of like creating a survey and then disseminating it to sort of capture community health workers who are working with in rural areas and with farm workers and largely immigrant communities in South Florida. And so, yeah, we've done that, and also been working with the Farm Workers Association in South Florida. And so, yeah, just trying to make it work as much as possible.
And it took 5 months to figure it out. Like it was from March until like July, you know, it took and then we didn't really start till September. So it took it takes time. So you work with community health workers. Have you gone to a Unity conference before?
I've been to, so the coalition works statewide. And so I've gone to their summits. They have yearly summits and local symposiums. By region. So yeah, I participated in.
So you're also giving me an idea, like the Latino caucus, maybe here, that we should have, maybe it requires like a webinar or a podcast about like, how are people dealing with the COVID-19 pandemic and doing community engaged work? I mean, that's really easy. We can, I think that, and it would be helpful for a lot of people about figuring out how they've dealt with it.
Yeah, I know that the coalition is working on trying to think of strategies to get people engaged in preparation for this, for a potential vaccine, and how to do that.
No, I think that's a great idea, because there's all kinds of theoretical things and practical things that really need to be worked out within this framework of how much compromise can you make within a community-based framework that it no longer becomes community-based, but where those boundaries are and how far you can push them, and what are the practicalities. I think I think that'd be a great seminar, podcast, whatever you're going to do.
Yeah.
Because I know with Felicia, this is something we had to really address, and we felt like we were out there by ourselves, just sort of making it up. You know, I mean, we got to do this.
No, if it's not a pandemic, it's something else. I promise you. So.
Right.
When I was working in Baltimore, the city decided, let's be a part of secure communities and have the cops be an extension of ICE. And that again was like 9 months of like the immigrant organizers talking to the African-American organizers who do like, you know, criminal justice reform about, why did you say yes to this when this means that you're being okay with racial profiling, right? It's like so I mean, there's always going to be a challenge in doing community-based work because there's real stuff that they're going through, and our projects, just like our scientific questions, have to wait. So there's always going to be something. It's just the pandemic is one thing. Next year is going to be another.
Sure, absolutely.
Well, I mean, I was thinking of when I was looking at Kiki here, and I'm thinking, think of the stuff. I mean, she was trying to do this work in Haiti, and she couldn't even get there, and then had to work out all kinds of different ways to try to interview people there about disability. So that was another thing where she was out on her own trying to figure these things out. So it's really, I think that'd be a great seminar, whatever you want to call it, you know, of how to do it.
That could be our second major event.
Yeah, could be. Yeah, exactly.
Well, Kiki has definitely put on, I know that she did an event at the university from our department, talking to researchers about these sort of challenges as well. And so, yeah, that would be great to discuss this further. Yeah.
It would be great to even have a kind of archive of even first person accounts mini histories of such projects so that people could actually go to the website and review them and hear first-person accounts of the challenges and how people worked around them and how they built coalitions, etc. That'd be excellent.
Yeah, I think Kiki was saying something. Kiki, were you going to say something?
No, I was just saying that it is something that is definitely feasible. And we have, as you mentioned, from that event, there is a field work group within UM that was created from there. And there are different, I think they had to cancel the event, but they're interested in revamping it, where different researchers will talk about how they're dealing with the COVID and the red tape, the challenges. So I know that this event had to be canceled, but if the group would like to create an event like this, I think there will be a lot of interest.
Great. Yeah.
Does anyone else
well,
have?
On that note, sorry.
Go ahead.
Any students have anything to say? Anybody? No? I see a lot of young students here, so I was wondering if they were, no?
Don't put the pressure on.
Oh, okay. No,
They're processing. They're processing.
no pressure.
Okay, well, thank you all for your
Oh, wait, looks like Tashina's getting ready to say something.
Yep.
Okay.
Sorry. I thank you so much for this. It's really putting a lot of, grounding some things for me. I'm for those of you who don't know me, I'm in Santa Cruz, an environmental studies PhD program. And so a lot of my research focuses on connecting to environment, and whereas looking at kind of blending the ecological and social aspects of environment. And so right now my research for my dissertation is broadening to community, some youth in a community in Salinas area, and looking at environmental health impacts and environmental harm. And so I'm curious, we had a guest speaker in our department seminar yesterday, on Monday, who spoke about community and looking at like Black farmers and getting to refocus on the framing of farming and the historical aspects of that. And the speaker talked about this asset-based framework in linking to community work. And I'm just curious if you guys could just share some thoughts about, so much the time, especially with health and environmental harm, it's seen as this deficit framework, especially with community work, of realizing the needs versus, and not brushing those aside, and also focusing on assets that communities have. But obviously with health and environmental harm, some of these are such pressing issues. So I'm just curious to hear you guys' thoughts about this as asset-based framework and how you all go about incorporating that into your framework and your ideology in conjunction with community-based processes, if that makes sense. Is that a clear question for you all?
Yeah, it's clear.
Yes.
So who wants to go?
Well, I mean, when you take the assets-based approach, I mean, and the originators of McKnight and Kretzmann, they were the first people to say that doesn't mean, by taking an assets-based approach doesn't mean that we're not recognizing that there are serious problems here to be addressed. People think it's just like, you don't focus on that, but instead of, it's really a way of looking at the community, again, not as simply nothing but deficits, but as people that are surviving through whatever issues that are facing them with a great deal of resiliency. And to look at sometimes, assets that exist within the community that are completely overlooked all the time, of how sometimes something that may not be an asset, with the right amount of organization and sometimes pressure and engagement with, say, a city government or county government or something, can actually be turned into an asset for people. So things that everyday kind of institutions and organizations that many times disenfranchised or poor people are not engaged with are right there and can become an important source for building something and actually solving problems. So it's really just a, like a mindset shift. Instead of just seeing the people in the community as having the deficits, you look at, for example, instead of like, there's a great community-based project that took place in South Central LA. And of course, through popular culture and everything else, everyone just sees that area as urban decay, horrible high crime rates, just really nothing positive going on there. And local community groups partnered with people from the universities and really presented a wholly different picture. Instead of seeing all the deficits of the people who live there in the neighborhood, they said this is a place that's suffering from lack of investment. It's not that there were problems that were emanating from outside of the community, from inside the community. It was that the normal kinds of investment that would be made, not only by private interests, but also by the city and county government weren't going on there. So it's a way of just shifting your mindset about how you look at the community and how you look at the people there and look at the ways that with some organization and some of the steps that we've already been talking about, Tashina, that you can begin to see it as something more positive. There's a really interesting community-based group in Miami called Urban Greenworks that is all focused around the idea of urban gardening. And and primarily in Black and Hispanic neighborhoods, this whole tradition of farming and how you can take, what are these vacant lots and empty places and turn them into really fruitful places, literally, for the community. So I'll let other people talk because I know there's a lot else to say about this.
So Tashina, I just want to tell you, the people here, people that know Tashina, if you want to connect with her, she's worked for years with me on various projects around the world. Okay, so I just want to let you know that she's really been involved in this type of thing. The thing you might want to look at, like if you get on the web, you look up John Kretzmann, and when he was at Northwestern, there's an entire archive there of all this work. So you could read all that stuff. But the other thing just about this is, I think this asset approach was really positive, but from a community-based perspective, recognizing that communities have assets doesn't necessarily lead you to interpret those things correctly. Okay, and so in a sense, this is like moving to sort of a holistic perspective, which is better than not. But if that holistic perspective just involves including a whole bunch of irrelevant data and a whole irrelevant information, it's not that much of a help. So in a sense, this asset thing can move you in one direction, but not necessarily in a community-based one. So.
Yeah, and I want to piggyback on what Dr. Murphy said about that. So I agree, we need to look at the assets. And when I teach my students how to do community development and health, community health assessments and stuff, I want them to also recognize the strengths in the community, but I also tell them the danger of resiliency, that body of knowledge, because it makes it seem like, oh, see, these people can put up with it. They've been surviving this whole time. And people say this, especially about the Latinx population, when they're like, oh, here, look at this epidemiological paradox. Your people are doing fine. We don't need to do anything. I've had literally Tom LeBeast, okay, say that to my face. But your people are doing fine. Why do you need to focus on them? And it's but you're looking at life or death, mortality statistics. That doesn't say anything about their quality of life. So there's a danger. I always feel a little bit afraid when I hear people say resiliency, because it's almost they're well, they can put up with it, so it's okay, or it negates that the suffering is happening. But I think the importance of using the assets-based approach is that it keeps us from pathologizing that group to continually pathologize them. And it really, and by you also acknowledging their assets, you're not taking this, that you could actually do the work bottom up, right? You're not taking this top down approach. So I feel like it has to be balanced. You can't just be assets based, because you're almost in a way just not, you're not even acknowledging what are the structural things, what are the, I'm really a policy person. If you don't change the policy, I don't really think you can, fix a lot of things. You can't, yeah. So, because the community will find a way to figure it out. They always do, but it always falls on them when it's just an issue of redistributing the resources.
Thank you. I don't know if anyone else has something else to say.
Okay, then with that, we'll bring this event to a close. Thank you all for your participation, not only as presenters, but also as participants bringing questions to the table. I think it's been a really successful inaugural event. And as
Yeah,
I
thanks
said,
a lot for coming.
the recordings will be available, and we'll let anybody who's been here know about how they can get access to those. Also, you can always go to our website, community health and justice.org, and join up for our mailing list. And you'll get any news about any upcoming events. As I said at the beginning, we're really oriented toward creating these kinds of relationships and maybe developing projects out of these relationships. So feel free to suggest to us other events that you might like to see us hosting, and we'd be happy to work with you on that. Okay, thank you, everyone.
Yeah, thanks a lot. Appreciate it.
Good night.
Adios.
Thank you. Bye,
Yeah.
everyone.
Good seeing you, everyone. Calvin and Declan, thank you.
Bye, Jung.
Bye.
Yeah, nos vemos. Adios.